Hey guys, so in today's video, I thought that I could talk about the pros and cons of being a medical assistant. And so if you see me looking down, I do have my phone right there because I wanted to make sure I wrote down some pros and cons just because, I want to make sure that I have everything covered that I wanted to cover. So I'm going to start with the pros. So we'll start with the good stuff first. Number one, it is very easy to get into the field of being a medical assistant fairly quickly. There are programs that take 9 months to 2 years. Mine actually took 16 weeks. So a lot of them will take 9 months to 2 years if you do it at like a typical college or community college, whatever. But my program actually took 16 weeks. So there's that. It just kind of depends on where you go, how long the program actually takes for you. So number two is a diverse work environment. So you can work in clinics, you can work in hospitals, you can work in an urgent care, you could work in a specialty office. You can also use your medical assistant certification in some situations to work in emergency rooms or to work on med surg floors. It just kind of depends on what the facility is in need of that is hiring. So make sure that you read the job descriptions very thoroughly to see if they will accept people who have their medical assistant certification, if that is something that you're interested in working. Number three would be the variety of job responsibilities. So a medical assistant combines clinical tasks with administrative work. So you're going to be taking vitals. You might be doing EKGs. You're going to be rooming patients. You might have the responsibility to deal with prior authorizations or billing procedures. It depends on the facility that you work at. You may also be responsible for scheduling. You may be responsible for assisting with procedures. You will probably give vaccinations or immunizations. You will probably administer medications. It just kind of depends on the facility that you work at, what they expect out of their medical assistants. Some facilities that I have interviewed at don't allow their medical assistants to administer medications because they have nurses, LPNs or RNs that administer medications. Other facilities, they basically give the medical assistants the same exact job responsibilities that their LPNs or RNs have. Number four would be the high demand for medical assistants. So medical assistant jobs are expected to grow steadily due to aging populations and expanded access to healthcare. I think that is true about most of the patient care related healthcare jobs in the United States currently. We are going to see the aging population continue to increase. And so as they leave the workforce, they're going to need more able-bodied people who know the skills to deal with the aging population. So, obviously you're going to be able to find jobs easier depending on where you live. I will say that because there have been places where I lived where you could find like 50 medical assistant jobs that are hiring, and where I live currently, depending on how many facilities are in your area is going to depend on the number of job openings that you can find. The next one would be that being a medical assistant is a good stepping stone to other careers. So if you're looking at becoming a nurse or a physician assistant or a doctor, or any other number of healthcare roles, medical assistant might be a way to get your foot in the door. Although I will say, if you are looking at becoming a nurse, I would say look at becoming a CNA instead of a medical assistant, because you can get into a CNA role a little bit quicker than you can a medical assistant role, depending on the facility that you work at, because some facilities are willing to train you on the job. But and if it's not one of those roles, CNA would probably be easier and quicker for you to get your foot in the door if you are looking at becoming a nurse. Also, some nursing programs require you to have your CNA certification before you start. So if you're already working as a CNA, that could help you in the long run. Number six would be patient interaction. You have direct contact with patients, and that can be something that is really rewarding. I absolutely love interacting with patients, And so I'm really looking forward to starting my new job as an ophthalmic technician, non-certified on Monday, so that I can get back to interacting with patients. I absolutely love interacting with people, and I'm really looking forward to getting back into it because I haven't been working since October of 2024, and as I'm filming this, it is May of 2025. So I'm really looking forward to it. So that was my last pro. Now let's get into some cons. So my number one con would be that medical assistants are not paid as highly as some other healthcare roles. So they are obviously paid less than LPNs and RNs, which I think kind of sucks if you have the same job responsibilities as an LPN to be paid lower than an LPN. Um, but I understand why, because you have more education as an LPN. Definitely as an RN, you have a lot more education than a medical assistant. So usually you have different responsibilities as an RN compared to a medical assistant. Um, but at the hospital that I recently worked at, even the CNAs were paid higher than medical assistants, and they expected medical assistants to administer medication and vaccinations that could literally kill somebody. Whereas the CNAs were doing basic patient care tasks. And so I didn't understand why the CNAs would get paid, you know, three, four, $5 an hour more than the medical assistants would. So that's a little bit frustrating. Con number two would be that um, the job of a medical assistant may be physically and mentally demanding. You're spending long hours on your feet, you have exposure to people who are sick, and you are expected to be very good at multitasking under the pressure of having to, room patients and move them in and out as quickly as possible. Especially if you work in an urgent care setting, you're going to be exposed to a lot more people who are ill. Um, because most of, like, if you work in family medicine, you're getting those physicals, annual wellness visits, and things like that. You're also getting sick people, but urgent care is more sick people than, you know, obviously you're not doing physicals and things in an urgent care. Number three would be limited advancement without further education. So you're kind of limited on how far you can advance as a medical assistant without getting another degree or going through another certification program just because of, you know, the nature of the job. Medical assistants have a very limited amount of advancement just because, you would have to go get a nursing degree or become an EMT or something like that in order to advance in the position, which by then you wouldn't be a medical assistant, you would be an EMT or a nurse. So just keep that in mind. Another thing would be repetitive tasks. If you are not somebody who likes repetitive tasks, please don't become a medical assistant because medical assisting is very repetitive. Whether you are working in urgent care or in family medicine or in a specialty, there is so much repetition that you do as a medical assistant that, it can become monotonous depending on the situation and the setting that you work in. You are rooming patients, which is a very repetitive thing, going from top to bottom, bringing a patient back. I mean, obviously, each patient's situation and medical background is different, but you still have to ask them the same questions. You still have to go through the same routine of getting them ready for the provider to see them. So it is going to be repetitive. So if you don't like that, you might want to keep that in mind. And the last one that I have is the job scope can vary depending on the setting, specialty, and or facility that you work in. Some clinics might expect medical assistants to do more than others, and some of them might expect you to do more without extra pay or without extra support provided. So please keep that in mind. For example, when I was working at the outlying clinics as a medical assistant, I would be expected to do way more than I was expected to do when I was working either in our main clinic or in the urgent care clinic, just because at the satellite clinics, there was only a receptionist, a nurse or medical assistant, and the provider. So there's a lot less people who can help you. And so you have to keep those things in mind. So that is basically it for today's video. I hope that this was helpful to someone who may be considering becoming a medical assistant. I definitely would say that it is a rewarding position, but there are, you do have to keep these pros and cons in mind. If you work as a medical assistant or if you have worked as a medical assistant in the past and would like to add something to my list, please feel free to do so in the comment section below. And also, if you have any other questions, comments, suggestions for topics you would like to see me talk about on my channel in the future, leave those in the comments below as well. And with that being said, I hope you guys are having a wonderful day, and I will talk to you guys in tomorrow's video.